Today we're kind of embarking upon a new journey here at Reardon Clinic. We've been on several new journeys in the last year, but it's one that I'm intensely interested in because we're going to tackle what I consider to be the biggest and the toughest and the most important problem in America today. And I think you've been watching the CDC's data sheets. And when you watch those sheets scroll past, you almost begin to think it's like a fungus or a mold or something that's just kind of sweeping the country, and kind of the invasion of the body snatchers type of thing. But yet it is real, and I honestly don't think it really depicts how invasive this issue is, because not only is it a problem of the risk of future illness that people are going to be confronting with obesity, but there is a very huge kind of change in self-concept and confidence, and there's a deep frustration and impotence that people feel in this area. And so you might be asking, why would the Reardon Clinic want to venture into this area? Well, we're here to create an epidemic of health, and this is the wrong kind of epidemic that's going on right now. But we're all about, and we've always been about, people becoming better co-learners, learning how to take better care of themselves, learning how to gain effective control in their lives. And this is one area over the last, I've been in medicine now 35 years. And this is one area where people feel a profound sense of loss of control and loss of freedom and loss of destiny, sense of self-destiny. And so we're here to help people learn to make the right kinds of choices. And it's not just a choice thing, it is a disease. But up until this point, no one has quite known how to approach it or what to do about it. So anyway, there's only one state left in the United States that has a obesity population less than 20%, and that's Colorado. I don't know what Colorado has going for it, whether it's the exercise or the fresh air or the mountains or what, but otherwise every other state, and this is 2009 data, and I suspect it's even worse here in 2010. We're going to talk a little bit about Fred and Joe here. That's not who they really are. My friend and the person that I've learned a lot about this from, Mr. Jack Challam, he and I have written a book on Stop Prediabetes Now, because prediabetes, diabesity, metabolic syndrome, it's all basically the same name for this condition that overtakes people. And I'm gonna right off the bat here put the target on where the problem is. It's visceral fat. It's belly fat. It's the paunch. It's whatever fun name you want to try to give it, but it isn't any fun. And it's, after a while, the jokes kind of wear off. And table muscle. It's the buildup of the fat around the organs, and it turns out that this creates another new organ in the body that sends out messages to the body that creates tremendous inflammation. And it's the inflammation that causes the insulin resistance that we're going to talk about here in just a second. Do you know what the #1 operation in the United States is right now? Male breast reduction. And which, again, once again, you know, it's kind of funny, but then it's not funny, because the guys, of course, are very sensitive about this. But we're going to talk about the mechanism why visceral fat ends up causing male breast tissue to develop. It's another example of abnormal fat. It happens in women too. Abnormal fat will develop in the breasts as well, and there's a lot of women who have to undergo breast reduction for this reason as well. So this type of fat, the pear it's still abnormal fat, but it doesn't create the inflammation like the apple, the central obesity causes. So central obesity, the apple shape, is more associated with higher risk for future diabetes, and with it high blood pressure, cancer, a number of different things. The visceral fat is the fat that builds up around the organs. This is a CT scan of a more typical, everyone develops a little bit of extra fat. That should be normal. But what's happening in our culture is something is causing 68% of Americans to build up fat around their organs and in their organs. Actually, fatty liver is a type of visceral fat. And we're calling this the metabolic syndrome, prediabetes, and a new term that's been introduced recently is diabesity, because there's a very strong correlation between obesity and the development of diabetes. But just so we all are on the same page, let's just quickly look at what metabolic syndrome X is. And so I'm going to use the X to illustrate the four corners of this. And so we have the development of the central obesity, the gut. And if you're not sure, I think the famous medical expert in the United States right now appears to be Dr. Oz. And Dr. Oz says, E.F. Hutton says, that your belt size is more important than your weight in terms of understanding whether or not you are at risk for this syndrome. And so with men, ideally you want to be 35 or less. You're going to be getting into the danger zone if you have a belt size 40 or greater. Women 32.5, men 37.5. But this really just goes back to, you can trace it all back to visceral fat. So when we say that the Reardon Clinic is going to start a weight loss intervention, that's actually just, we decided to call it that because that's what's going to, people are going to perk up a little bit on that. But really it's a visceral fat intervention is really what we're interested in. If you let it go, your blood pressure will start to creep up. That's part of Syndrome X. Your lipids will get high, and you'll probably be put on a statin drug. We're very used in this country to going into the doctor and getting one or two things measured, and here's the medicine to treat that thing. But I'm often reminded of the patient who got very mad when the doctor just was walking out the door, and just as he shut the door, he was saying to the patient, "And you need to lose about 45 pounds." And the patient opened the door and says, "Doctor, you do too." And so it's a problem because doctors know that it's a problem, but most doctors don't know what to do about it. There is no one pill that treats it. Then, of course, over time, your blood sugar will start to go up. Jack and I wrote the book on prediabetes. The reason we did is that prediabetes is your opportunity to make an intervention before it gets worse. That's why the American Diabetic Association created that designation, is to help people intervene before the future problems started to occur. And that's, if there's anything good about this, it's a visible sign that you have an opportunity to do something now that can help you avoid future problems. This is, of course, becoming very prevalent, Syndrome X, and as you get older it becomes more prevalent. It's pretty much equal in men and women. Here it's listed at about 40% at age in the 60s. I did a talk in London about 2 years ago on prediabetes, and so I went ahead and looked up the numbers for the United Kingdom, and they're percentage-wise they're not doing a whole lot better than us, but in terms of the BMI, 40 million people have a BMI greater than 30. And the BMI doesn't always tell the whole story. It's a measurement, it's a calculation from your weight and your height. But really, you can see just that alone, 40 million. People are overweight, 180 million. Hypertension, 50 million. High blood lipids, cholesterol, over 100 million. Prediabetes, 120 million estimated. Metabolic syndrome, 68 million. So the numbers are a little bit all over the place, but these illnesses together take up a lot of our medical care system right now, and all of the problems that stem from them are becoming more and more common in our culture. And if that weren't bad enough, we're seeing it in the kids. 15% of kids are now overweight. It was 5% in the 70s, 11% in the 90s, 22% of African American and Hispanic children. Diabetes in children is up tenfold in the last 10 years. And so this is really at the cutting edge of where this is going. Unfortunately, we are really becoming victims of the Western lifestyle. And when we see it in kids, and I think it's really going to come home to roost when we start hearing about 16-year-olds and 20-year-olds who are having bypass surgery of their heart, heart attacks. And this is all part of that escalation of the inflammatory response. Less than 25% of children exercise regularly. So really the key question here is, what causes this? Because if we can identify the underlying cause, then we have a greater chance of actually correcting it. And the official terminology here is insulin resistance. Insulin resistance is where you are making insulin, but your cells are not responding to it. The receptors are resistant to it. And it's this insulin resistance that leads to the development of visceral fat. Because when you have higher insulin levels, which your body has to do in order to get the glucose in, insulin is a fat storage hormone. And so it not only stores fat, but it blocks the mobilization of fat. And so you get into this vicious cycle of having the buildup of fat. This is why visceral fat is like another organ. It causes insulin resistance, but that then doubles back and causes the development of more visceral fat. Without going into a lot of detail here, your cell membrane every cell has insulin receptors, and when these receptors get overworked, they start to become dysfunctional, and you start developing insulin resistance. Now, from an everyday, real-life perspective, I'm going to throw in there that stress is a major factor here. Like this poor lady here is experiencing a little bit of stress, and when you're distressed, what do you go for? Well, you need comfort food, right? So she goes for the donuts, which gives her a blood sugar high, like the roller coaster, but then on the other side of the going up the roller coaster ramp is coming down. And so the hypoglycemia will hit an hour or so after she has the sweet, high glycemic food, and hungry, headachy, sweaty, confused, just not feeling very good, which can, of course, lead to more donuts. And if you keep that cycle going over and over again, with time, you will develop the insulin resistance, the metabolic syndrome. This is a little bit of an exaggerated case, but this is a true metabolic syndrome. And the problem with it is you start getting into what I call self-defeating thoughts. You know, I'm not a good person. I'm a weak person. I have no willpower. The confidence level goes down. The frustration level goes up. What's happening as well that most people don't know about is that when you have insulin resistance, not only can you not get glucose into your cells very well, you cannot get amino acids in very well. So this big guy, even though he's overweight, on the inside he's lost a lot of muscle mass. He may have even been on some diets. And the big problem with diets is that you can lose some weight, but very often you're losing muscle mass. Well, what burns calories? It's your muscle. And to make this even worse, like a lot of the kids these days are consuming the sports drinks because they want to be cool, they're jocks and all that. Well, really they're not, because they're thumb jocks with the video games, but they're not necessarily consuming the right things, or they're consuming a lot of pop. Well, what does this contain? Fructose corn syrup solids, which is processed through the liver in exactly the same way as alcohol. And a large majority of children are developing fatty liver syndrome, adults too. And it's another manifestation of diabetes syndrome X. And it's the inflamed liver that more than anything else causes the insulin resistance. And this is the reason why the guys are starting to have trouble with developing the breast tissue, because when you have higher amounts of fatty tissue, it contains an enzyme called aromatase, which converts in men the testosterone to estrogen. And there are more estrogens in our food supply as well. And if you have a liver that's sick and you can't break down estrogens, your estrogen levels just keeps building up, and pretty soon you've got an embarrassing development of male breast tissue. Anyway, you can see how this could be a huge vicious cycle. And it's tough to get out of it once you get stuck in it. And here at the Reardon Clinic, what we spend most of our time doing with our patients is looking at this web of causes. Inflammation, infection, which I'm not really going to go into today, but I think chronic infection plays a role in I did a lecture here a couple years ago called the pot belly syndrome. People who are putting on visceral fat very often have chronic low-grade infections. Stress, which can produce more cortisol, which weakens your immune system, which is a body's attempt to try to mitigate against the inflammation, but that wears out your adrenals. And then you start feeling tired all the time. Your food choices go to pot. You begin developing nutritional deficiencies. Your digestive system, you get more of an irritable bowel problem. You get yeast overgrowth. You're building up toxins in the body because of all the environmental factors that are in our day and age. The toxins disrupt the endocrine organs, especially the thyroid. The thyroid is very important in terms of metabolism, and a lot of people who are struggling with this whole condition of insulin resistance also have type 2 hypothyroidism. It's where the cells don't respond to thyroid hormone very well, and it doesn't show up in the blood tests. So you go to the doctor, you know you're not feeling good, you have all the symptoms, but the tests come back normal. And all in all, you just don't exercise as much, you can't move as much, and emotionally speaking, it starts to become one big kind of mess. And that's all insulin resistance is the very root cause, but it's the insulin resistance that's giving rise to the visceral fat. So the answer to the question, what to do, is ultimately it's you. You've got to take charge of your own situation, because what I'm finding out here is it's kind of tough to get it's tough to get it. Well, I won't say this in general. It depends on your doctor. But a lot of doctors are getting very, very busy. And the time that they are willing to spend in terms of helping you unravel this ball of twine is becoming less and less. And so for the last 35 years here at the Reardon Clinic, that's what we have specialized in. And that's why Dr. Reardon referred to what we do here as the Sherlock approach. You know, we are detectives. It's a process of discovery where we encourage you to become involved in that process and take charge of the various components that give rise to these self-complicating conditions. So my banner, people, everyone's talking about healthcare reform. In my books, true healthcare reform is self-care reform. Until we learn how to take better care of ourselves and people actually are effectively dealing with insulin resistance and all the web of causes surrounding insulin resistance, we're never really going to solve the crisis, because the crisis is being born out of a lack of people knowing what to do about their lifestyles or what to do to change this fundamental underlying cause. And so you might be asking, okay, doctor, I get it, where do I start? What do I do? Well, and this is the second tenet of the Reardon approach, treat the underlying cause. And so what is that cause of obesity? It's, as I've stated, it's visceral fat. How do you get rid of it? Okay, Fred and Joe, they want to know. Would you be willing to do something like this? Now this is a 500 calorie a day diet, and I had many patients for the last 2-3 years coming into me and say, doctor, have you heard of the HCG dietary plan? I said, well, I've heard a little bit about it. How many calories is in it? And they would say, well, there's 500 calories in this diet. And I'd say, oh, don't go that way. That's dangerous. That's a starvation diet. And I kept kind of doing that. I was guilty of the very thing that I hear other doctors say about many of the things that we do out here. They're against it before they even know what it is. And so what happened was about 3 or 4 months ago, maybe 5 months ago now, I had a patient of mine who I've been working with for 3 years from Liberal, who she really was working, like most of the people I know who are working on their weight, they are very diligent, they're trying, they're doing everything. She was consulting with me, we were doing food allergy testing, working on her thyroid. We were trying to unravel this web of causes, and she was staying pretty much the same weight. Losing a little bit, gaining it back, losing a little bit, gaining it back. And it was frustrating for me, frustrating for her. And we had a phone consultation because it's a 4-hour drive, and so I was checking in with her to see how things were going. And she says, "Doctor, I've lost 27 pounds in the last 3 months." Well, what did I ask her? Are you okay? Do you have cancer? You know, because the general mentality of most physicians is that, you know, most people who are overweight cannot lose weight and keep it off. That's the general mentality, and I probably had that, a little bit of that, probably a lot of that myself. And so she said, no, she says, I've learned about this HCG program. And I said, oh, that one. And she says, yeah. And she says, there's a compounding pharmacist that's a friend of mine down in Wichita Falls. She said you could talk with her. And so that's what I did. You know, one of the neat things about working here is that Dr. Reardon developed this concept of co-learnership. And if you think about what that word really means, being a co-learner means that you, the doctor, has to be a co-learner with you. So I thought, well, she's lost 27 pounds, she feels good, she says it's working for her, maybe I better give this pharmacist a call and see what the story is. Because I had never really done much with it. So on a Saturday afternoon, I called her, and 2 hours later, I had gotten a real earful that even this pharmacist, a year and a half before, had thought the whole thing was a bunch of hooey. But then she started having a doctor out at the Air Force Base in Wichita Falls, started using it and getting reversal of diabetes. When she said that really got my attention, because my big interest is in diabetes and prediabetes, because I know how terrible of a disease that is, and it happens, it's just what diabetes is. It's the very insidious gain of visceral fat, insulin resistance, and then all the complications that go along with diabetes. So I kept talking with her, and so what we decided to do was to do a beta group where myself, my wife, and 3 nurses went on this, because the other thing I learned from Dr. Reardon is don't prescribe anything that you haven't tried yourself. And I'll get back to me in just a little bit, but I was, at that point in my life, I thought I was doing pretty good, but I found out I could do a lot better. And that's to me the whole key, and one of the things I even learned in going to school. The teachers used to say, you can always do a little bit better, Ronnie. So, and I did. So anyway, the main reason I think people need to pay attention to this is that by adopting this, you can reduce the risk of many future illnesses. Our young kids that are developing the diabetes, oftentimes it's being diagnosed as attention deficit disorder, and they're put on some kind of an amphetamine. If you go to an internal medicine doctor, he's going to tell you you have hyperlipidemia and hypertension. You get put on a medicine for that. If you would have come to see Jack Chellam and I, we would have said, oh, you've got prediabetes, and we had a book that you could read, but it didn't have a very structured approach to it. It was kind of a lot of good information, but it didn't tell you what to do. A lot of doctors will just accuse you of just being overweight and undermotivated. You know, and I think a lot of doctors kind of, because they feel helpless too, there's this attitude that develops along that line. And then when you have your heart attack, oh, I guess it's real. So there's a bunch of different things that can start to happen here. Retinal hemorrhages, that would be a late thing with diabetes. So a lot of problems can be avoided if we could treat this condition. So it's now known that this is an epidemic. This was back in 2001. The Public Health Journal said obesity will soon overtake smoking as the leading preventable cause of death, and that obesity has a greater morbidity, which means side effects, decrease in quality of life, than smoking, problem drinking, and poverty. That's a pretty strong statement about what we're dealing with in this country. So here we go. Let me just I'm just going to take another 15, 20 minutes here to explain to you what I learned from that pharmacist that Saturday afternoon. Once I opened my mind to thinking about how would this possibly work when so many other diet programs have failed. Because there's a very high rate of failure when it comes to people losing weight and keeping weight off. So we're going to talk about a molecule. Now, I am especially, once we started talking in the realm of hormones, that's an area that I'm actually very interested in. For the 22 years that I've been at the Reardon Clinic, I've worked with natural thyroid hormone. I've worked a lot with people who have adrenal exhaustion. That's a hormonal intervention. We're getting more and more interested in age management, hormone replacement therapy. So I know that hormones can be a very powerful way to change how the body functions. And what is the definition of insanity? Insanity is doing something the same way and expecting a different outcome. So when I got to thinking about it, part of what had closed my mind to the HCG approach is that, does everyone know what HCG is? It's the pregnancy hormone. It's human chorionic gonadotropin. And I thought, how in the world could that have anything to do with obesity and visceral fat? It's a hormone, 244 amino acids, heterodymic, which means it has two subunits. One of the subunits, the alpha subunit, is the same as luteinizing hormone, follicle stimulating hormone, and thyroid stimulating hormone. But the beta unit is unique to HCG. It's made during pregnancy. It helps maintain the corpus luteum when the egg pops out of the ovary. What's left behind is the corpus luteum. The corpus luteum makes progesterone. So it's a very important part of having a healthy pregnancy. It's used in fertility treatments, and now it's being used as a weight loss treatment. This really got started with what I'm going to look upon as a genius. He was an endocrinologist. Obviously, he's studying hormones. He originally studied tropical diseases in India, where he discovered a remedy for malaria. He developed a special stain for diagnosing parasites, malaria parasites, and he was awarded the Red Cross Order of Merit by the Queen of England. So Dr. Simmons was, in his day and age, had very high reputation as an endocrinologist and a world researcher, until he started studying obesity. Then, he lost credibility because no one wants to really look seriously at what's causing obesity. But at that time, in 1949, obesity was a rare disease. It only occurred in people who were rich, because only they could afford the rich kinds of foods that now are ubiquitous. You can go anywhere and you can get very rich, sugary, high glycemic foods in our culture and have less and less activity, just because that's what's happened to our worldwide culture. But anyway, he practiced at this Salvatore Mundi hospital, which became a kind of a very clandestine spa where many wealthy people from around the world would come and receive the simian treatment for weight loss. And he did not let this out for a long time. But after a while, he decided he would go ahead and write this book. And for those of you that end up doing this program, you will have to read this book at least once, and I'm preferring you read it 3 times because it's a very well written book. Any book that can withstand with the tincture of time has got to be well written, and this one is, because what he does in this book is he comes down to the core issues of why people become obese and why it's so hard to get out of the trap of obesity. So pounds and inches, in my mind, is a kind of a survival of the species quality of scientific breakthrough. In that foreword, he says that it discusses a new interpretation of the nature of obesity and a new approach to obesity. It describes a method of treatment that is growing out of theoretical considerations based upon clinical observation. In the next few slides, I'm going to tell you what he observed and why his observation was so critical in changing our understanding of the nature of obesity. And so he worked for 40 years in this area, looking at the problem of obesity, its causes, its symptoms, and its very nature. And he worked with thousands of cases. So it's not like this guy just dabbled a little bit into it. This was, in a sense, this was the key work of his life. So let's go through there are really two observations that he made that are very germane to scientifically understanding why this makes sense as a way of dealing with people who have resistant obesity. He's found that there were two groups that lost fat rather than muscle when they were on a very low-calorie diet. Most everyone else, if you're on a low-calorie diet, what happens? You start looking kind of grim and you lose facial muscle. And we're going to talk a little bit about how a lot of people, when they go on a diet, they get sole pain and heel pain and why that is. But this, he said there were two groups that was not the case. The first group, he was in India. Remember, he studied tropical diseases, and he was in India. And there's very little food, and a lot of people and very little food in India. But he found that some of these women who hardly gained any weight would have full-sized, full-weight, healthy babies. And he wondered, how could that happen? They're hardly eating anything, and here they're going to have an 8-pound baby. Where did the calories come from that grew that baby? So, and remember, what's the HCG is the pregnancy hormone. Second one is the so-called fat boys that he ran into in India. This is a very severe endocrine condition that is actually it was successfully treated with low-dose HCG. It was a pituitary condition, and we're going to come back to why that's important. He deduced that the HCG must be programming the hypothalamus, which is the part of the brain that regulates all of our important basic functions. It's programming the hypothalamus in the calorie-deprived pregnant woman in a way that protected the developing fetus. And probably all of you have heard of women who, even here in the United States, they get very severe morning sickness, or what's called hyperemesis gravidarum. They don't eat for several months, and sometimes 5 months, and they'll still have a healthy baby. So nature has put in this protection system to where the baby can get calories from the mother's fat, and we're finding out maybe because of the HCG. HCG was promoting the mobilization and consumption of abnormal excessive adipose deposits, another name for visceral fat. Now here's the Froelich syndrome, the so-called fat boys, also known as the adiposogenital dystrophy. And Penny was asking me, why do you want to put that weird slide in there? Well, I'm going to show you, Penny, why I wanted it in here. Remember I showed you Fred and Joe with their breast tissue? These guys were developing the feminine obesity as well. They were having growth and sexual retardation, just like what's happening to the guys in our country. What's the number one sponsor of all the athletic events here in the United States these days? It's no longer beer, it's Cialis and Levitra, and there's a reason for that. There's a reason for that. Headaches, mental retardation. I probably shouldn't say it, but I was saying there's evidence that that's happening, at least in the political realm in our country. But the polyuria and the polydipsia is the diabetes. It's prediabetes and diabetes and increased appetite and tumors of the hypothalamus. See this? You see how Simeon's kind of started putting two and two together? And so when these boys were given HCG, it reshaped. This is a very important word. It reshaped their bodies by reducing the visceral fat without loss of muscle tissue. So there's three types of fat that we're dealing with. Most people just think of fat, but there's really reserve fat, which you would get if you eat a little extra calories. Your body should store it so that you can use it later. That should be normal. Then there's the structural fat, which fills out our face. It's the padding that keeps our body looking normal. And then there's this abnormal visceral fat, and that's what develops in the abdomen. And I had another patient who's he eats a low-carb diet. He works out every day, but he's developed the gut. And he actually went to a plastic surgeon to see if he could get liposuction, and the plastic surgeon examined him and said it wouldn't do any good. He says, all your fat is inside the abdomen. I could liposuction your abdomen, but most of it's still going to be inside. And that's why just doing a lot of crunches isn't the answer to getting rid of the visceral fat. So when we start thinking about the characteristics of obesity, constant physical hunger, low body metabolism, high food cravings, eating when not hungry, abnormal storage of calorie reserves in visceral areas. And very often people go to the endocrinologist and the thyroid and the glandular, the sex hormone, all that tests out to be normal. But there is a kind of quiet desperation in this particular scenario. So if that person goes on a diet, they will oftentimes lose structural fat and muscle. And this is why, without understanding the whole premise of the HCG program, I just said, no, I don't think it's a good idea. If you go on 500 calories, you'll lose weight, but it's going to be the wrong kind of weight. And you're going to get weak and hungry and depressed. You're going to get that your face will look long and skin drawn and haggard. And you'll lose fat in the wrong places. You'll lose the fat you don't want to lose. Wrinkling, you look like you've aged rapidly, and then when it starts to come back, getting really frustrated and depressed, and the yo-yoing effect that is so predominant. But it's really important that the key distinction that we're making here is the difference between visceral fat and structural fat. Here's someone who's been on a diet and they've lost structural fat. Now, and I was just reading this. One of the books that we give as part of the program is very thorough, and I was going through it and rereading the Pounds and Inches book from Dr. Simeon, and he said that he had patients come in that have been on a calorie-restricted diet, and what they got was sole pain or heel pain. Has anyone ever had that before? Tried to go on a diet and your feet start to hurt? It's the loss of the structural fat in the padding of your foot. And so by going on the HCG, even though it's on a low-calorie diet, the heel pain will go away because you will restore the structural fat. And there's all kinds of pictures on the internet. I don't know who this lady is, but she did the HCG plan, and this is what typically happens. And I can tell you this because my wife has lost 25 pounds on this, and after 20 years of struggling to find a way to lose weight, she lost the weight she wanted to lose. So HCG goes after the visceral fat, the abnormal fat, not the structural fat. That's one huge key distinction that Simeon's learned, and that is still true today. I've already mentioned this. The hypothalamus regulates a lot of involuntary functions in the body, but one of its most important functions is to regulate the storing and issuing of calories. So what HCG does, see all these hormones that I mentioned earlier, the alpha subunit and the beta subunit, the TSA, they're made by the pituitary, and the pituitary is regulated by the hypothalamus. So the HCG program is a way of resetting the set point in your hypothalamus. And what Simeon's thought is very often this hypothalamus, due to stress, infection, injury, whatever, gets dysregulated, and an abnormal accumulation of neuropeptides often due to stress. And you hear that very often as people will have some traumatic event occur in their life, a divorce or something, and they'll gain a bunch of weight. So due to abnormal hypothalamic function, the organism accumulates fat well over its daily requirements. The adipose tissue metabolism in obese patients behaves differently from normal structural fat metabolism, making this fat resistant to dietary intervention alone. And I have so many people who have tried to diet. I always told them that in my book, diet was a 4-letter word. And it's always tough. And then the hardest thing, though, is, and the thing that just makes your heart sink, is someone's worked very hard, they've lost weight, and then it comes back. Well, we don't want that. We want something that changes the way your body actually processes the abnormal fat. And that's what we're talking about in terms of the HCG plan. The HCG plan that we've put together here is the Simeon plan. We're doing it in the context of the resources that we have here at the clinic, because the key thing, I think, is to have a well-structured plan where you can go through it, not have a lot of hit and miss, but having someone guide you through the step-by-step process. Because the way I see it, for many people, this is kind of like your last. It isn't your last chance, but it's like most people that I know have tried just about everything else, And so we want this one to be the big one. This is the one that can help you actually get over the hump. So we have a 51-day program if you have less than 20 pounds to lose, and an 85-day program if you have more than 20 pounds to lose. The HCG component of the plan, which lasts for about 23 days in this first one and 40 days in the second one, that's the long as you go on it. If you try to do HCG for longer than 40 days, you start to develop what Simeon's called immunity. So you then take at least 40 days off and do it's a special maintenance plan that he developed, a very low sugar, what I would call a very low glycemic, healthy, whole foods plan in order to help you stabilize the changes that have occurred in your hypothalamus. And instead of calling it maintenance, to me maintenance has a little bit of a negative connotation, like you're just struggling to keep where you are. I'm looking at it as lifestyle renewal. The 5 people that went through with me, myself, my wife, and the nurses, for them, it was a new beginning. It was a new whole shift in attitude about food, about how they felt about themselves, and a greater willingness to make the changes that they always wanted to make in terms of their exercise, their sleep, their relationships, all the things that you cannot ignore if you want to have a successful outcome. So the monitoring plan, to me, was the part that really made this work. That, I'm not going to say that I just suddenly, after that discussion with the pharmacist, everything was completely hunky-dory. I have a show-me component in me. I need to be shown that it really does work. We are going to have a laboratory panel, a group doctor's appointment, weekly body composition testing. There are some conditions we'll be monitoring for: gallbladder disease, gout, hyperlipidemia, unstable diabetes, hypertension, uterine fibroids, and abnormal menstruation. So what makes this plan effective is that it's actually very simple. Janet Beard, who's the pharmacist in Wichita Falls, says it's the easiest, hardest thing you'll ever do. And I'm going to emphasize the easiest part because it's really not that hard. It's just that you have to kind of be ready to do it. And her advice is don't do it until you know you're ready to do it. But once you're ready, it's like once my wife got started and she was every day waking up and another pound was coming off the scale, I could not have tore the HCG stuff away from her. She would have killed me first. So our goals on this plan, well, first of all, you want to have goals. You got to have goals. You want to lose weight, but specifically visceral fat weight. You want to reset your set point, and you want to renew your lifestyle so that this becomes a permanent thing. I've already talked about this. Break old patterns and self-defeating attitudes, reboot your metabolism, create new habits of health, and take back control of your health and your physical destiny. So just to show you, by doing the body composition testing, and this is what's called an impedance test. You lie on the table, a couple electrodes are placed on your hand and your foot, and a small electrical current, which you can't feel, is run through your body, and it's computed. And depending upon how fast it goes, the computer can figure out how much fat you have. And so this female who's a nurse that was born in 1953, she had actually been on another program that we had started with that was kind of a protein type program, and had lost just a teeny bit. She was at about 44% body fat. But this is September the 17th when we started our beta group, and this is 8 days later. So again, it's really astounding for people to suddenly see themselves losing about a pound a day for the most part. Some guys lose 1.5 pounds or 2 pounds a day. And it kind of looked like it wasn't changing too much, but then over the course of her 40 days, it was continuing to go down. And even during her maintenance, where she's not even trying to lose more weight, she continued to lose. Matter of fact, she didn't lose weight, but she continued to lose fat mass. So she went from 44% down to 28%. So that's a 16% loss in body fat. But more importantly, and this to me was the coup de grace that shifted me into saying, wow, we need to seriously think about doing this here at the clinic, is that she gained muscle mass during this entire time without a lot of extra exercise, just some gentle walking. Exercise is not, you don't avoid exercise, but nor do you try to promote a heavy exercise program with the Simeon approach. So she gained muscle mass without strenuous exercise, just following the HCG plan and the lifestyle renewal plan following that. So another thing that I've always felt a passion about is that if I'm going to do what I do here in terms of helping people achieve a higher level of wellness, is I have to try to live that change myself. And so unfortunately, I'm sorry to say, when I was giving that talk on pre-diabetes back in London that I told you about earlier, back in October of 2008, Jack took this picture of me. And I was, this was in the Westminster Abbey courtyard, but it's like a jail. You know, I thought after I look back on this, it's like I'm in jail, because you can't really, a lot of people said, well, you didn't look like you were that much overweight. But in fact, I had 31% body fat at that point, and I weighed 203 pounds. And when Jack and I were walking around seeing the sights of London, I'd always have to sit down because my hip was hurting and I was tired. And he said, boy, you're getting old, aren't you? That's the worst thing you can say to a guy, of course. But I had to admit it. The CRP is a marker for inflammation. It's one of the tests that we'll do on our patients that are coming through this program. So anyway, so here I was. This year in March. I was 29%. I was working on it. Here's about 29% here. There's about 27%. This is the day before I started the HCG. Was at about 26%, and then 8 days later, when I was retested, it was down to 16%. So that's about a 14-pound shift in fat. That's about a 14-pound shift in 8 days, which to me, I honestly did think the machine was broken. Except so 4 days later, though, I came back in and it was still low, and 4 days later it was still kind of going down, and then I left for Japan to do I was a speaker for about a week, plus the trip over and the trip back, and I was not really I wasn't even counting calories or anything at that point, and by the time I got back, it was down to 8% body fat. So I went from 203 down to 167 body weight. That's the body weight. But the actual fat composition dropped to 8%. But again, I mean, it's great to lose fat, but you want to be sure you're not losing lean muscle mass, lean body mass. And the beauty of the impedance testing is we can document for you that you're not losing muscle mass. Because I guarantee you, if you go on this, you're going to have your friends tell you the same thing I was telling my patients. So that can hurt you. You're going to lose your muscle mass. You're going to look terrible. You're going to feel terrible. We can document. You can pull out your paper and say, "Oh no, I'm not. I'm gaining muscle mass as a result of the redistribution, the reset of the hypothalamus that the HCG program does." Now you can get homeopathic HCG over the internet, and a lot of people are going that route. The prescription strength of HCG that we will be getting from the pharmacy down in Wichita Falls, we're going to use them because I'm so appreciative of the time she took with me to demonstrate how this worked. One of her concerns is that if you do use homeopathic, first of all, you really don't know for sure what you're getting. I mean, unless you want to go visit the place that makes it. But even if you go visit and see how it's made, homeopathics are made through a series of dilutions. And it's been calculated that homeopathic HCG is about 1/trillionth the potency of this. You've got just a few molecules of the HCG there in the spray. And I know people have gotten it to work for them, and I'm not saying it's not a valid way. And the other thing I'm concerned about, though, is if you're just spraying in water and you go on a 500-calorie diet, yeah, you're going to lose weight, but you may be losing muscle mass. You may be accidentally going into the trap that I wanted to avoid and that I was afraid of with people on a 500-calorie diet. you may not get the reset of the hypothalamus and the resculpting of the visceral fat when you're using unknown and unpredictably low HCG dosages. So as a physician, my responsibility to my patients is to make sure they're getting what Simeon used in his protocol, which is about 125 units of the HCG. Now, a pregnant woman in the prime of her pregnancy will be making about 300,000 units of HCG. So this is a very tiny dose, so you guys don't have to worry that you're going to... I had a test question where I said the reason guys lose weight is because they feel like they're morning sick and they don't want to eat anything. That's not true. It has nothing to do with, and it does not change sexuality function whatsoever. If anything, what I told someone is that if the guys can lose their visceral fat and reduce the amount of testosterone that's being converted to estrogen, it will improve their sexual functioning that way. Okay, so it's my responsibility to make sure that you get the right stuff, and this pharmacy has successfully used it in over 4,000 patients. And a couple nights ago, I talked to one of the family physicians. There's about 40 doctors now in Wichita Falls that are using this program successfully. And I talked to one of the doctors who's treated over 200 patients. He says it's one of the most fulfilling aspects of medicine that he's been in. Because most of the people that are going to go through a program like this have suffered many, many defeats. And he says, well, he himself, he went through it twice, and the first time he lost 20 pounds, and he was so excited about it. His mother, who had been overweight her whole life, he said, okay, Mom, we'll go through it together. And I really do believe in the buddy system. If you can find a buddy to go through on this, I think it works really good. But anyway, he went through with his mom, and he lost another 30 pounds. So he's lost 50 pounds himself as a physician using this HCG program. So we will prescribe your HCG in conjunction with a professionally structured monitoring program to assure that you are losing visceral fat, not lean muscle tissue. So I don't believe in starvation dieting, and I don't believe that this slows your metabolism. Here's another point that I should have put a slide in on this, that when you're on HCG and a 500-calorie diet, you're still burning 2,500 calories a day because you're losing about anywhere from 1,500 to 2,500 calories of visceral fat. So the metabolism is still burning at that normal rate, but you're only consuming 500 calories, which Simeon's found was necessary to get the HCG to begin to work in terms of the metabolic transformation. So this is just a slide. You've got this in your handout. These are the components of it. You get a guidebook that's very good, a tracker book, the pre-programmed blood testing with 39 different measures, the prescription HCG nasal spray, sublingual B12, vitamin packets, one IV. The days 3 to 7 can be a little bit rough because you're burning off so much fat. The body carries a lot of toxins in the fat. So sometimes you can feel a little rough those 2 days. So we have an IV, a short little Myers IV, which we call the IV Essentials, to help people with that. Weekly visits with our HCG nurse educator, BIA testing, the impedance testing, access to a weekly doctor conference call, and we're going to have an online forum for people to share their experience. Oh, and then the next slide is Penny. So I'm going to let Penny talk for just a second, then I'll answer your questions.
Yeah, we'll have time for questions. I just wanted to show you
Rest my voice.
A couple of things. This is the HCG weight loss cure guide that you'll receive. This is the My Tracker booklet. So you fill it out every day with what you eat, and you take this to see Nurse Meg when you go for your weekly appointments. And Meg, would you mind standing up, please? This is Nurse Meg, and Meg is a RN, and she's also our HCG educator, so she's the person that you would be meeting with weekly. I tried to make her come up here, but she would not. She said, I'll just stand back there. So Meg's a critical and important part of the program. And one of the things, let me show you the rest. This is your sublingual B12. So every morning, I'm on the program now. Every morning we take the B12 sublingually. It's kept in the refrigerator. And this is the nasal spray. I'll kind of spray it over here. You pump it a couple times and it gets going. You up one nostril and then up the other, and that's it. You also have the program including a vitamin packet. They're already parceled out for you. It's 5 vitamins. Most of us that are on it here at the clinic take it with lunch, but that's all included in the program. And just to kind of give you an idea what's happened for us, yeah, you go ahead and pass those out. I'm having 2 things passed out. One is a really comprehensive frequently asked questions document. As I said, this is kind of a sneak peek. We're not really open to the public yet on this.
Right here, you better.
Okay, well, does this help?
Yeah.
Okay. We're not really open to the public yet, so we'll have all of this on our website beginning in January. But the frequently asked questions should answer a lot of questions if you don't have time to ask Dr. Ron today. And the other paper is really an overview of the program itself. It's the slide again about the number of days you're on the different stages. And then it also talks about what is the diet when you're on the 500 calories a day, what's allowed and what's not. But just to give you an idea, in the 2 weeks that we have a group of 11 people here that have done it, the first week we lost 60 pounds with 11 people, so we were really pleased about that. And we just finished our second week and had our appointments with Meg today, finished those up, and we've lost another 41.9 pounds. So 11 people in 2 weeks have lost 101.9 pounds. So it's really compelling information, hopefully. Yeah, that's great. And I want to point out Donna and Nicole. They're passing things out. They're currently on the program. They said I could call them out. Donna in the red, who many of you may have known, she's been here for over 30 years. She has lost 19 pounds in 2 weeks. And Nicole is a great example of somebody who's went through a full cycle of the program. Nicole did the 23-day program and then did maintenance, and in that period of time, she's lost 25 pounds. So they're real examples of people being able to do it every day. So Dr. Ron has went through what all the comprehensive and the program includes. I think probably one of the most important things besides the HCG spray is the fact that you do meet with the nurse educator every week, and she's doing your BIA analysis and showing you the chart that Dr. Ron showed, so you can see. It's very motivating to see what's really happening, where in most diet programs before you've never had the opportunity to see that. To get started, again, we're not starting up the program today. We are taking people that would like to join as kind of advanced reservations. You choose which program is best for you. And if you have a sheet in front of you, were there any extra sheets, Donna? Yeah, that one. If you look at the sheet in front of you that's entitled Overview, you would pick the 51-day program or the 85-day program, depending on the amount of weight you want to lose or your commitment that you have to it. You would schedule an appointment for a blood draw because, as Dr. Ron said, you know, health measures are so important to us. So you would have a blood draw in advance of starting the diet, which we all did. And then after that, we do a group doctors program. And you make your appointment with Nurse Meg and you get started. So from the time you make a decision to the time that you start, it's roughly going to be about a week and a half to go through those steps. But the first meeting you have with Nurse Meg, she does your initial BIA analysis, your weight, and she gives you all of your information, your books, your vitamins, your HCG spray. So it's an all-inclusive cost. And now we'll open it up to questions. If anybody has any questions about the program, raise your hand. We have.
I just want to mention also that you can subtract about $200 or so off the cost of the program depending on which one you go through, because you're going to eat that much less food, because 500 calories a day doesn't cost that much. So yes ma'am.
Yes, I wanted to know if this can be paid for monthly.
I don't know if we have it. I don't think we have that set up at this time.
We do not have a monthly program set up at this time to start in January.
Does Medicare take care of it?
Insurance does not. What we have found, insurance does not cover it.
Is there a flat cost for it?
Yeah, the cost is, it's on the last page of your document. The 23-day program is the 51-day program, which is 23 very low calorie diet, is $5.99, and the 85-day program is $8.99, and that's all inclusive.
Is there maintenance after the
Yeah.
program's over?
If you look at, did you get the handouts?
What's going to happen here is there's a lot of, many people have been on many other programs before, and there's going to be a confusion between terminology. But the full, like for example, on the 40-day program, that's 85 days that you're on the program, half of it on the HCG, and the other half on the lifestyle renewal / maintenance program, where you will be coming in and continuing to get your body composition measured. Like I want to show you on our other nurse, that she actually she was actually on the program. I think this is where she ended the HCG program, but she continued on maintenance. Now, during the maintenance phase of this, Dr. Simeons wants you to keep it the same weight. But what we've already discovered is that even if you stay at the same weight, you can still lose body fat and gain muscle mass. So you're still metabolically changing during the second half of the program.
I think what Nurse Nicole found is, I think, Nicole, you've lost 10 pounds on your maintenance, correct? So she not only maintained, she lost. And to answer your question, if maintenance is included, if you look at this handout right here, which hopefully everyone got, the lifestyle transition or the maintenance phase, I think we think is one of the most important, because that's where you're maintaining the weight loss. And it is included in the cost of the program, including the weekly appointments with the nurse educator to see you through that portion. If you have more than 20 pounds to lose and you want to do another cycle, you would just start the complete other cycle again. So another 85-day cycle or another 51-day cycle, depending on what you wanted to do.